Hi, I'm Marvin Plackett, and today is Monday, May 11th. Greetings to all residents, to all staff, and to all guests. We have no more confirmed COVID cases since Friday when I reported that we had a total of 4. You will recall that that is 3 staff and 1 resident. The 1 resident lives at Seabury, and the 3 staff, 2 work at Episcopal Church Home in the kitchen, and 1 is a certified nursing assistant at Episcopal Church Home. I'm very pleased to report that in all 4 cases, they are doing fine. The resident at Seabury and all 3 staff, they still have some symptoms, they are recovering, and they are doing fine at this point. So very pleased for them, and also, of course, pleased that there are no more confirmed cases of COVID-19 at this time. We were just informed that the Minnesota Department of Health has assigned a caseworker to us, to Episcopal Homes. The first conference call is going to occur this afternoon, so very pleased about that. Pleased to know that we have the added support of the resources of the state of Minnesota should we need that support. We, of course, as I mentioned last week, as I've mentioned for now the last 2 months, we are following all of the recommendations from the Health Department, from Centers for Disease Control, from Centers for Medicare and Medicaid Services, and we get daily updates, etc. But it's also good to have a caseworker assigned to us so that we can, if we have more specific questions to our situation that are unique to us, that we have someone that we can go to gain additional advice and insights and assistance. I'm going to repeat just a few things that I mentioned last Friday. Remember that your safety, all residents, all staff, you are our #1 priority, hands down. And to accomplish that as best that we possibly can, we're continuing to do the following all the Minnesota Department of Health, CDC, and CMS guidelines. We're going to lead by example. We're going to enforce the rules. We're going to always be of service to you. We're going to focus on the facts and not the fears. We're going to stay calm and strong. And remember that I'm going to be here every day giving these updates every single day, so you will be kept informed. You know, as we all know, over the weekend we heard on the news that there are 3 cases in the White House. So while we're doing all of these things, and while we're enforcing all the rules, while we're doing our absolute best, if COVID-19 can invade the White House, where the walls to the White House are as substantial as they can be, and of course I mean literal and figurative, and if it can penetrate the White House, well, then even though we're doing our best, we cannot be assured that it is not going to invade Episcopal Homes more than it is. All the more reason that we all have to do our part with sticking to the rules that we put in place 2 months ago of social distancing. That is the #1 most important thing. Staying at least 6 feet apart. 6 feet apart is 3 arm lengths. Staying that far apart. Wearing your masks when you're not in your rooms or in your apartments. Very important. Frequent hand washing. Staying within your communities and within your zones, right? That is the best that we can do at this time. Those practices, and we all have to cooperate to keep not only yourself safe, one another, your neighbors, your loved ones safe. Those are vital at this time. This is hot off the press. Just about 30 minutes ago, I saw this from Associated Press. The White House is recommending that all nursing home residents and staff be tested for the new coronavirus in the next 2 weeks. Vice President Mike Pence, who leads the White House Coronavirus Task Force, told governors on a video conference call today, Monday, that it's the federal government's strong recommendation that such testing be done. Dr. Deborah Birx, the task force coordinator, told governors to focus over the next 2 weeks on testing all 1 million nursing home residents. She says the White House will help states that need it. So we'll see how that unfolds. I haven't gotten any other information beyond that, just from Associated Press, saw that. Let's see. Remember that this week continues to be, well, not the whole week, today and tomorrow. These are the remaining 2 days of National Nurses Week. If you have not yet reached out to a nurse or multiple nurses, do that. Tell them Happy National Nurses Week, all right? Tell them how grateful you are for their services. They will appreciate it. An announcement from Kristen Aitchison. Jim Johnson, many of you know him. He lives at Cornelia House, has for now many years. Jim Johnson will be here in costume and is going to be playing the bagpipes tomorrow at 2 o'clock. He's going to start playing in the parking lot, and then he'll walk around the block hitting the Lyndhurst and Feronia windows. So tomorrow, 2 o'clock. So for roughly 30 minutes, you're going to be serenaded to some bagpipes by Jim Johnson. Thank you, Jim. And let's all stay tuned for that. All right, let's see. I want to encourage you. I want to first thank Eileen Lardy. Eileen lives at Cornelia House, and she forwarded a YouTube video to me today and to a few others. It lasts just 3 minutes. And if you have a smart TV or if you have a computer, I strongly recommend go to YouTube and then put in the search, put in "You'll Never Walk Alone," and that's in quotes. And it says, and then it also says, so the full title is "You'll Never Walk Alone, Virtual Choir / Orchestra, 15 countries, 300 people." I strongly recommend that you do that search and watch that video, and be sure to have a tissue in hand, because I believe you're going to need it. It's absolutely inspiring. It's so beautiful. You'll be glad that you did that search, and again, on YouTube. See you tomorrow at 1:30. And now for some words from Marcia Schwartz. Marcia is our receptionist at Episcopal Church Home, has been with us for many years. Lovely lady, and we're very grateful for the work that she does at Episcopal Church Home. Marcia.
Thank you, Marvin. Yep, I've been here a long time. Hello, friends. My name is Marcia. As you know, I'm one of the receptionists at Episcopal Church Home. Do you notice the flowers blooming, the birds in the trees, the beautiful blue skies? We have so much for which to be thankful. A few years ago, I had a health scare. During treatment and every day since, I have made it a point to be aware of the everyday miracles around me. I believe it is important to be mindful of the people and the things we tend to take for granted. I can take care of myself. I have a job and a home. I like the people I work for, you, and with, you, and so on. I cherish the sun and the rain, fresh air and decent health, and friends who are family. I call it living with an attitude of gratitude. Back then, I wrote a little song, and it has been popping into my head a lot lately. I'd like to share it with you. If you're blessed and you know it, thank your God. Thank you, God. If you're blessed and you know it, thank your God. Thank you, God. If you're blessed and you know it, let your lifestyle show it. If you're blessed and you know it, thank your God. Thank you, God. Look for the beauty and make it a beautiful, blessed day, folks.